when you see a child who is presented in your board exam with these things, please start thinking about the possibility of sepsis or congenital infections. So, what are the common presentations of fever in children who are less than 3 months of age, which at times may not be so obvious? So, there are some non-specific features. One of them is irritability. You realize that the child is very irritable. The child is very irritable. They may be lethargic. They may feed poorly, so they may not be latching onto the breasts very well. They may be vomiting. They may have diarrhea. These point to badness in these children, right? It could also be as a result of an alternative diagnosis like colic, like viral infections, like an early urinary tract infection. And they may also present with tachypnea and hypoxemia. When you see these symptoms, start thinking about pneumonia in that child. And then they may have bulging or full anterior fontanelle. We learned that. It may suggest meningitis. And in neonates, always remember that neck stiffness is a bit rare in them. And then they may also present with, crying. They're so irritable. They are inconsolable even when they are crying. When you see that, it's a very, very, very strong clue for meningitis. And then you can also look at their skin exam. You look for redness, which may point to cellulitis. You want to look at the umbilical stump. So you want to check for umbilical infection. You want to check for a vesicular rash, possibly as a result of HSV, right? And then never forget to look into the ears. Look into the ears and look into the throat, because they hide a lot of infections there, because that can be pointing to acute otitis media. The other thing you have to understand is that normal vital signs in a kid with all these nuanced presentations does not mean that there is no sepsis. The kid can have sepsis and have normal vital signs as well. So your antenna must go up, bing, when you are dealing with these kids.